the acronym is LLLT, low-level light therapies, involve the use of red light and infrared light. Sometimes low-level light therapies involve the use of UVB, but more often than not these days when we hear LLLT, low-level light therapy, it's referring to red light and near-infrared light therapies. Low-level light therapies have been shown to be effective for a huge number of biological phenomena and medical treatments. Low-level light therapy with infrared light has been shown to be effective for the treatment of acne and other sorts of skin lesions. Been some really nice studies actually where they use subjects as their own internal control. So people, believe it or not, agreed to have half of their face illuminated with red light or near-infrared light and the other half of their face serve as a control, and to do that for several weeks at a time. And you can see pretty impressive reductions in skin lesions, reductions in scars from acne, and reduction in acne lesions themselves, meaning the accumulation of new acne cysts with low-level light therapy using red light and infrared light. Sometimes, however, there is a resistance of that acne to the low-level light therapy such that people will get an initial improvement and then it'll go away despite continuing the treatment. So you're probably asking, or at least you should be asking, how is it that shining red light on our skin can impact things like acne and wound healing, etc.? Well, to understand that, we have to think back to the beginning of the episode where I described how long wavelength light, such as red light and near-infrared light, which is even longer than red light, can pass through certain surfaces, including our skin. So our skin has an epidermis, which is on the outside, and the dermis, which is in the deeper layers. Red light and infrared light can pass down into the deeper layers of our skin, where it can change the metabolic function of particular cells. So let's just take acne as an example. Within the dermis, the deep layers of our skin, we have what are called sebaceous glands that actually make the oil that is present in our skin. Those sebaceous glands are often nearby hair follicles. So if you've ever had an infected hair follicle, that's not a coincidence that hair follicles tend to get infected. Part of it is because there's actually a portal down and around the hair follicle, but the sebaceous gland is where the oil is created that is going to give rise to, for instance, acne lesions. Also in the dermis, in the deep layers of the skin, are the melanocytes. They're not just in the epidermis, they're also in the deeper layers of the skin. And you have the stem cells that give rise to additional skin cells. If the top layers of the epidermis are damaged, those stem cells can become activated. And you also have the stem cells that give rise to hair follicles. So by shining red light or near-infrared light on a localized patch of skin, provided that red light is not of such high intensity that it burns the skin, but is of sufficient intensity that provides just a little bit of damage to the upper layers of the skin, the epidermis, and that it triggers certain biological pathways within the cells of the sebaceous gland and the stem cells within the hair cell niche and the stem cells in skin, what happens is the top layers of the skin are basically burned off by a very low level of burn, and or the cells in the deeper layer start to churn out new cells which go and rescue the lesion, essentially clear out the lesion and replace that lesion with healthy skin cells. This does work in the context of wound healing, getting scars to disappear. It also works to remove certain patches of pigmentation. There are sometimes cases where people will get a red blotchiness due to certain skin conditions, or some darker pigmentation that they want removed or that they need removed because it's a potential skin cancer threat. Now, how is red light actually doing it within the cells of the sebaceous gland, the stem cells, etc.? Well, long wavelength light can actually get deep into the skin, I mentioned that before, but can also get into individual cells and can access the so-called organelles, which I described at the beginning of the episode. In particular, they can access the mitochondria, which are responsible for producing ATP. Now, the simple way to think about this, for sake of this discussion, is that as cells age, and in particular in very metabolically active cells, they accumulate what are called ROSs, reactive oxygen species. And as reactive oxygen species go up, ATP, energy production in those cells, tends to go down. It's a general statement, but it's a general statement that in most cases is true. There are some minor exceptions that don't concern us that have to do with cell types different than the ones that I'm talking about now. So the way to think about this is that red light passes into the deeper layers of the skin, activates mitochondria, which increases ATP, and directly or indirectly reduces these reactive oxygen species. These reactive oxygen species are not good. We don't want them. They cause cellular damage, cellular death, and for the most part, just inhibit the way that our cells work. So if you've heard of red light or near-infrared light therapies designed to heal skin or improve skin quality or remove lesions or get rid of scars or unwanted pigmentation, that is not pseudoscience. That is not woo science. That is grounded in the very biology of how light interacts with mitochondria and reactive oxygen species. Some of you may also find it interesting to note that some of the cream-based treatments for acne, for instance, like retinoic acid, retin A, is actually a derivative of vitamin A, and the pathway involving retinoic acid and vitamin A, believe it or not, is very similar to the natural biological pathway by which photopigments in the eye convert light information into biological changes within those cells. So the key point here is that light is activating particular pathways in cells that can either drive death of cells or can make those cells essentially younger by increasing ATP by way of improving mitochondrial function.